Hi, I'm Dr. Roth. I'm a podiatric foot and ankle surgeon, a master's in public health, and I'd like to thank you for allowing me to put my application in for the Innovation Challenge. I'm very excited to tell you about my procedure, Paincur, which has the ability to change the way we treat pain throughout the world. I've been working on my invention for 4 years now, and I've treated hundreds of patients. And so I'm just going to give you basically an idea of what it's all about. So first of all, I found a way to turn off the pain receptors to the body. The medicines I use are completely safe and innocuous, with no known side effects other than just your typical, injection irritation, which is extremely rare. But let me give you an idea. So if a patient comes in with any kind of pain, if it's from the waist down, we put the injection in the foot, and if it's from the waist up, we put the injection in the hand. So typically if someone has a sciatica, L3, 4, 5, S1 pain, knee pain, hip pain, foot pain, ankle pain, whatever pain it is, for whatever reason it is, especially nerve pain, it works extremely well for it. We put the injection in the foot. If it's just on one side of the body, we just put the injection on that one side. If it's something like sciatica or lower back pain, we'll go up both channels on both sides of the feet, so we'll give injections to both feet. And the same thing for the upper body. So it turns off the pain. Of course, we're not resolving any of the issues. We don't. It's not healing anything or making the problem go away, but it gets rid of the pain. I'll give you some examples. It's very good for diagnostic purposes. So I'll have some patients come in with quote-unquote neuropathy, they think, and if it's a lower back problem, really, then the injection will work. I have Paincur 1 and Paincur 2. Paincur 1 is given once or twice or maybe 3 times, depending on what you need, and it's for acute problems. So let's say someone hurts their shoulder. They can come in here and we give them one injection and the pain goes away. Typically, if they're younger, whatever that means, certainly 20s, 30s, 40s, and 50s, it's almost as I'm pulling the needle out. It's a subcutaneous injection. Sometimes it might take a few minutes, maybe 15 or 20, and on the extreme end, maybe take a few hours to even a full day. But certainly somewhere in there, the patient's going to have relief. It works for Paincur 1 almost 100% of the time, meaning relief will happen, whether it's full relief or partial. It's usually significant. So again, if someone comes in with a sprained ankle, I can give them the Paincur injection, number 1, and they walk out of here and don't even know they have a sprained ankle, and we can start them on rehabilitation pretty quickly after that. So for let's say you have a terrible dental problem, we can give them an injection and it'll buy them 24 hours before they have to go into the dentist, so you don't have to give them narcotics and things like that. I also see Paincur for emergency room use, after surgery, rehabilitation, after surgery. It'll get rid of pain, swelling, get you to start moving the joint immediately. So the recovery time, it reduces the recovery time significantly in the amount of early range of motion and exercises. Same thing, post-op patients, fabulous, get rid of pain. Paincur 2, which is the chronic cases, we give a series of approximately 7 injections within a 2-week period, and we slowly turn off the pain receptor, and by the 3rd or 4th injection, typically they don't have any more pain, but again, give them about 7 injections, and then their pain can be long-term or permanent. I have many patients with years of pain relief. Just comes to mind, I had a patient with a severe ankle injury. They had had surgery. It was crushed. They were recommending a new ankle implant or a fusion. I gave them the injections, and he has no more pain. He's hiking, lost about 50 pounds, etc. But like I said, it's great. It's great for gout. And again, it's given in just one spot. You don't give it in the joint. You don't give it where the joint's broken or you have the injury. You just give it in the hand or the foot, and it's subcutaneously. I really feel this has a great future for the pain medicine, the world of pain medicine. I had one patient that had end-stage cancer. They couldn't get out of bed. They couldn't drive their car because they were doped up all the time. And the last stages of her life, she was able to drive, get around, and be comfortable. So all spectrums, but it works incredibly well. And thank you for this opportunity. I'd like to obviously present this and hopefully win the challenge, because the world needs to have this procedure. Thank you very much. If you have any questions, please give me a call, and I look forward to seeing you at the convention. Thank you.
Hey, my name is Jared Smith. I am a patient of Dr. Roth here, and I've gone through the whole series of Paincur treatments. And I have to tell you, after thoracic lumbar surgery, I was in considerable pain, limited function, limited ability to participate in sports like surfing and running and so forth. Gone through the entire process, amazing results. I mean, it was about halfway through where I started to experience some relief from the pain, and it's almost non-existent anymore. And I suffered through a considerable amount of pain and was using a lot of pain medicine and so forth, and it's absolutely a miracle. And I'm not the only one that I know that has used Dr. Roth. Several of my friends have, and it's an exceptional program, and you absolutely have to go for it.
Hi, my name is Dane Dufour. I am 63. I've been a patient with Dr. Roth since November of 2022, so about 3.5 months. I had the full Paincur treatment in November, and in 1980 I had a pretty bad accident, and my right ankle was kind of disintegrated in the accident and was put back together with literally 1980 type of corrective measures. Excuse me. I over those 40 plus years, got to where I could do less and less, and the last 5 or 6 years I gained almost 278 pounds total, and was not able to walk. And in this last 3 months, I not only can walk, but I've walked a 6-mile hike and an 8-mile hike, including Griffith Park, and have no pain and very little, if any, swelling at all. And I highly recommend anyone to try this procedure, because it made a change in my life to where I've lost 40 pounds as well, and continuing to lose weight and feel much younger and much better through this whole process.